episode is brought to you by Premensal.
I think the biggest thing is if you are noticing changes in your cycle, you really need to see a specialist fast, because you're not going to have a lot of time to try and get those eggs because your egg number is probably reducing.
Welcome to Thriving in Menopause, brought to you by Prevention Australia. I'm Zoe Mernier, the editor of Prevention, and in today's episode, we're diving into one of the most confusing and often surprising aspects of midlife health, and that's fertility during perimenopause. It's a time when your hormones may be fluctuating, your periods might be irregular, and yet, yes, you can still fall pregnant. For some, that's an unexpected joy. For others, it's a wake-up call. And for many women trying to conceive later in life, it can be a time of uncertainty, questions, hope, and at times despair. To help us make sense of it all, I'm joined by endocrinologist Dr Devini Ameratunga, who specialises in hormonal and reproductive health. Dr Dev brings both clinical expertise and compassion to this complex topic, and we're thrilled to welcome her back today. Thanks for joining us, Dr Dev.
Thanks for having me again, Zoe.
Okay, so can you start by explaining what's happening hormonally during perimenopause in terms of our fertility?
Okay, so if you don't mind, I'll just go very quickly back to basics.
Yeah.
So as you know, we're born with all the eggs we're ever going to have, right? So these eggs will naturally undergo DNA damage with age, and just like our other cells, they age. So with perimenopause and menopause, okay, sorry, Zoe, can we start that again?
Yes.
Can you just say your question again?
Would it be straightforward for me to ask, can you start by explaining what's happening hormonally during perimenopause and how it affects fertility?
So what's happening during perimenopause is essentially your body is running out of the eggs to be produced every single month. So in perimenopause, whether that's be whatever age that would be, our body gets to a place where every month we don't ovulate. And that's because our pool of eggs to choose from is dwindling. Usually in Australia, the average age of menopause is around 50. It doesn't mean we've completely lost all our eggs. It just means that every month or every day, that group of eggs that are recruited by your brain are getting a bit less or not recruited at all. So perimenopause, you have quite a bit of hormonal shifts. Like 1 month, you might have a great egg that's picked up just like normal reproductive age, or 1 month you might miss an egg. So because the egg and ovulation is what keeps your hormones, regular, you start to see these hormonal shifts. So it's all about the dwindling kind of amounts of eggs that we have in our body.
Ah, right. Okay, that makes sense. So for women who are hoping to conceive in their late 30s or 40s, what are the key challenges that they might face during perimenopause?
I guess the key thing is egg quality. So, when we're born, we are born with 2 to 3 million eggs, and we will never make any new eggs after that. In fact, we lose, close to 1,000 eggs a month just naturally, would you believe? Just like our skin, sheds, our eggs die. Yeah, I know, it's crazy. So, even at the age of 50, we have eggs. It's not that we've run out of eggs completely. It's just that those eggs have been with us for 50 years. So the natural DNA damage that happens to anything like our skin, our heart, our brain muscle, same thing happens to our eggs. So the chances of having a good egg released at the age of 40 is much less than at the age of 30. So the biggest issue with perimenopause is the age at which you're going through it. So I often say that, because I have patients who are going through menopause as a teenager to whenever, 50 plus. I say to my 30-year-old patients who are going through menopause, it is better for us to have even one egg at 30 than unfortunately having, 3, 4, 5 eggs at 43, 44, because the DNA damage we would expect to be much less at a younger age just because our eggs have not been with us for that long. Does that make sense?
Absolutely, absolutely. And how do ovulation and cycle regularity change during this time?
Yeah, so often with menopause or perimenopause, the first thing that you start to see is that cycles get a bit shorter. And that's because the follicular phase in a cycle, so the early part where eggs are recruited, actually changes in perimenopause because of the really high brain hormones, FSH, that is produced during this time. So it's actually quite complex. But to make it a little bit, just in general, cycles tend to become shorter. And then with time, they tend to become longer, actually, between, to the point where you might even skip cycles. So I think the biggest thing is, if you are noticing changes in your cycle, you really need to see a specialist fast, because you're not going to have a lot of time to try and get those eggs, because your egg number is probably reducing. So whatever eggs we have, we want to try and help you as much as possible.
We often hear about AMH, or anti-Müllerian hormone, as a marker of fertility. Can you explain this for people who might not know what that is, and explain how useful this test is for women in perimenopause?
Yeah, so AMH is a hormone that's released by the growing follicles in a cycle. So essentially eggs, follicles are the sacs that have the eggs in them. So it is a marker of ovarian reserve, how many eggs you have left. It's helpful for predicting how you respond to fertility treatments, but it doesn't predict whether you can get pregnant naturally or the quality of your eggs. So in perimenopause, we would expect that number to be low, because we don't have as many eggs. Now, it doesn't tell you, even if it's low, that you have 100 eggs left or anything like that, but it can put you on a scale according to other women your age. And it also allows, like, fertility specialists like us to figure out what doses and what to expect in an IVF cycle. The key is, if it's low, it might give you an idea of when you will go into menopause as well. So I always tell patients, really, even in your 20s, to know your AMH is a good thing. It's about empowering yourself and knowing what your fertility looks like. It doesn't mean that you'll necessarily change anything, but in the person that it comes back very low, it might. You might think about, getting help earlier, conceiving earlier, or preserving your fertility a bit earlier, like egg or embryo freezing. So in perimenopause, if it's low, we know that you probably don't have a long time to get to menopause. So whatever help we can give you, we want to give that to you as soon as possible.
Yeah, that makes a lot of sense. So let's talk about options for women who would be wanting to get pregnant at this time. What are some of the fertility support or treatment pathways available to women during perimenopause?
Yeah, so, even if you're perimenopause, I guess what you need to know is your number of normal eggs coming out is not as great as if you were, a younger. Like, if you were younger and perimenopause, that's different, as I mentioned.
Yeah.
But say we're just assuming you're over 40, just for podcast sakes. That means that over 40, realistically, 1 in 2 eggs will be DNA abnormal. So what that means is, really, in a 12-month chance, if you're having regular cycles, 6 of those months, you'll have a good chance of having a pregnancy. The other 6 months, mostly you won't get pregnant, or you'll have a risk of miscarriage. So the older we are, the less chance we have of an ongoing pregnancy. So, IVF is pretty much the highest chance of pregnancy in general. But if you're not getting many eggs, IVF is also not great. So it's really important to speak to someone who can look at you as an individual, look at all of your factors, including age, how many kids you want, your AMH, male factor if you're partnered, and things like that, to really tailor a plan that is suited for you. One size in perimenopause does not fit all. It really needs to, have someone to have a look at what's the best thing for you. And that sometimes is something simple, like just monitoring ovulation or timed intercourse or whatever. But a lot of the time it might be IVF or going through, with that, or even genetic testing to ensure you have a healthy baby or, embryos. Things like egg freezing is not really relevant at this age. So, if you're over the age of 40, I'm saying, but if you're going through perimenopause at 30 or 25, which unfortunately does happen, absolutely, it's very important.
Yeah.
So, there are a lot of factors to consider. It's actually a little bit complex, but, those are the really important things. And I think patients need to also remember that egg donation or embryo donation are excellent excellent options. And, where we can talk you through all of those options as well, if you see a specialist.
So just going back to, you talked about timed ovulation, timed intercourse, that kind of thing. How tricky is that to do when you are in perimenopause and your cycle is not doing what it's normally doing?
Yeah, very, very tricky, actually. So, but I guess, even if you go through premature ovarian insufficiency and you're less than, 40, you have a 2 to 3% chance in Australia of conceiving naturally. Over the age of 40, just because of age, it's a bit trickier. But in general, if you are finding it difficult to check your ovulation, you can use these ovulation kits and all the rest of it. They're not that accurate in some cases, especially if your hormone levels are not, the normal, I suppose. So I guess if you're just trying naturally, timing intercourse, if you're having intercourse every few days, you cover the entire cycle. Remembering that sperm lasts in the tract for up to 5 days. So, you can have intercourse every 3, 4 days and you'll be covering the whole cycle. So I often tell my patients who are so stressed, they've been peeing on these sticks for months and months on end to do away with those, let me take that burden. And sometimes I track ovulation myself in these patients from blood tests and scans so that we can get as accurate as possible for that timing.
Yeah, for sure, for sure. On the flip side, many women assume that once their periods start becoming irregular, they don't really have to worry so much about falling pregnant. But obviously that's not really true, is it? So can you talk us through what the chances are?
Yeah, so no, it's not true. It does, seen plenty of friends, colleagues, patients, go through all this fertility treatment when they're younger, then all of a sudden they're pregnant. Look, it does again depend on your age. So, someone who's going through menopause under the age of 40, you still have a good chance, like I said, 2 to 3 to 4% chance of natural pregnancy if they spontaneously ovulate. The chances of that happening after the age of 43 is extremely low, but it's not impossible. So, I mean, it's the person's discretion and risk. And the commonest thing that obviously happens if you do get pregnant naturally over 43 is unfortunately a miscarriage because of the DNA damage of our eggs. So, it's about people wanting to get pregnant is very different to people, not wanting a pregnancy. So when people are chatting to me about not wanting a pregnancy, I say, have contraception till 12 months after you last, when you're diagnosed with, menopause. So 2 years after menopause. And then those who are wanting a child, but say they've gone through heaps of fertility treatments, they've tried everything and they can't get pregnant, then I say to them, you know what? Have regular intercourse. Your chances are not zero. Yes, it's very, very low, going from the early 40s onwards, but it's not zero. So that is something that you can still do, even if fertility treatments have stopped. It's not always the be all and end all when we stop, but it's, there are still some chances, very low.
Yes,
but there are.
yes, that needs to be said. And are there any lifestyle factors, nutrition, supplements, stress management that can support fertility at this life stage, or how likely are they to kind of move the needle on that?
Look, probably a little bit. We certainly know that detrimental factors can be quite detrimental. So, smoking, too much alcohol, those things definitely are going to have an effect. Being overweight or too underweight can affect your egg quality. Environmental factors, exposures to things, pesticides, things like that, they can have a negative effect. But in a healthy person who is getting adequate nutrition, who's a good weight and living, a really healthy life, it's tricky to add things on to improve your egg quality. Now, there is some data. There is some data of certain things like, coenzyme Q10, NMN, for example, that potentially can improve your egg quality. And for whatever it's worth, I chat to my patients and I give them these things anyway. Mediterranean diets help. So we try everything. Because we're at that stage, most of my patients are desperate. I've been there. I know what it's like. And we want to optimize everything, and we should. But how much it affects our, egg quality is unknown. Age, unfortunately, is the single factor that we can't reverse at this stage.
Absolutely. Are there any signs or symptoms, apart from the cycle and what that looks like, that might suggest that fertility is declining faster than expected?
Yeah, look, there are other factors, especially things like family history. If you've got people in your family that that have had early menopause or issues with fertility, certainly you need to see someone earlier. Symptoms of menopause, changes in your, hot flushes or any of those things. Abnormal periods. So anything that's indicating that you might have, I don't know, PCOS, endometriosis, all of those other things that impact fertility. So you need to kind of keep all of those things in mind. And I guess what I tell, when I'm just doing education to people is just to have an idea of what your cycle is and what's normal for you. Go with your gut feeling. If you think that something's not right, it's not going to hurt to get checked out.
Absolutely.
And people in their 20s, 30s, and don't think you're too young for perimenopause. Unfortunately, due to environmental factors and genetics that we often don't know a lot about, these things are becoming more and more apparent, So get checked out, even if it's for peace of mind.
So you are seeing an increase in early menopause, do you think? Or
Well, it's hard for me because I see a lot of
yes.
my patients are a specific type, I suppose. But I guess we're just looking at things a bit better because we know some of the genetic factors that are contributing. So we're doing those tests a little bit earlier, So some of these genetic tests are now Medicare rebatable. So I guess we're just diagnosing it a bit more. I don't know if the prevalence is increasing, but probably the diagnosis is.
For sure. And obviously trying to conceive later in life can come with a lot of emotional weight, hope, fear, even grief, and that feeling of time running out. What advice would you offer women feeling really overwhelmed by this chapter?
Yeah, look, it's really hard. And I think getting good information early is important. Knowledge is power. Speak to someone, a fertility specialist sooner rather than later. There's absolutely no point blaming oneself for any of those things, which for some reason all patients do, right? You look within yourself, but there are plenty of options as well, but time does matter. So I think get the emotional support that you need. It's a tricky area, fertility, and then going through premature menopause or anything like that just adds on a huge complexity. But people who treat these conditions have those supports and the resources to help you. So I think my main thing is get knowledge and help early.
Yeah, for sure. And for those who are mourning perhaps a path not taken and who may be navigating the end of their fertility, how can they begin to process that with I guess kindness to themselves?
I think acknowledge the grief. It's real and it's valid. There are counselling support groups and, exploring the other parts to parenthood or nurturing roles can be healing in itself. It is very difficult and I validate that all the time with my patients. And I guess we need to normalise the fact that we don't all get the family we once desired or wanted and that's life. Then we have to work through that,
Yeah, absolutely. And if there's one piece of advice or reassurance you could give to any woman navigating fertility during perimenopause, what would that be?
I guess I'd say you're not alone, and it's not too late to get that knowledge or ask questions. Whether you want to try for a baby or you want to close the chapter, there's still time to take charge of that reproductive health and to speak to people who know, so that you can find peace within you and your family moving forward.
All right. Well, thank you, Dr. Dev, for shedding light on a topic that's too often overlooked or misunderstood. Whether you're trying to conceive, avoid pregnancy, or just understand your body better, knowing what's happening hormonally can be incredibly empowering. So we really appreciate you taking the time today.
Thanks so much for having me, Zoe.
And to our listeners, thank you for joining us. If this episode brought you clarity, comfort, or even just a sense of solidarity, we'd love you to share it. Subscribe for more conversations like this one with experts who care. And for more great advice on thriving in midlife, be sure to pick up a copy of Prevention Magazine. I'm Zoe Mernier. See you next time.